Are you a new parent trying to decide whether or not to circumcise your baby boy? The decision to circumcise can be overwhelming, but don't worry, we've got you covered. In this video, we'll be breaking down the pros and cons of circumcision and giving you all the information you need to make an informed decision. So sit back, relax, and let's get started. Hi there and welcome to Yardy Baby. If you're looking for a channel that features baby-related tips and information every day, then you're in the right place. So make sure to hit that subscribe button and join our community. Today's topic is circumcision, a common surgical procedure in which the foreskin, or the skin covering the tip of the penis, is removed. It's a practice with a long history and is still performed in many cultures and religions today. But it's also a subject of debate among healthcare professionals and parents. So what are the pros and cons of circumcision? That's what we'll be exploring in this video. Before we dive into the pros and cons, it's important to understand the history of circumcision. It's believed to have originated in ancient Egypt as a religious ritual, but it's also been practiced by various cultures and religions around the world for thousands of years. In modern times, circumcision rates vary widely around the world. It's most common in the United States, where around 60% of newborn boys are circumcised, but it's much less common in other countries. Now let's take a look at the pros of circumcision. Some people argue that it can help reduce the risk of certain infections, such as urinary tract infections and sexually transmitted infections. UTIs are more common in uncircumcised males, and while they can be treated with antibiotics, they can be painful and potentially serious if left untreated. STIs such as HIV, genital herpes, and human papillomavirus (HPV) are also more common in uncircumcised males, but it's important to note that circumcision is not a guarantee of protection against these infections. In fact, safe sex practices such as using condoms and practicing monogamy are much more effective at preventing STIs. Circumcision may also lower the risk of penile cancer, a rare but serious type of cancer that affects the penis. It's more common in uncircumcised males, but the overall risk is still low. Circumcision may also reduce the chances of developing problems with the foreskin itself, such as phimosis, difficulty retracting the foreskin, and paraphimosis, inability to return the foreskin to its normal position. These conditions can be treated with medication or surgery, but circumcision can prevent them from occurring in the first place. On the other hand, there are also cons to circumcision. It's a surgical procedure, so it carries risks such as bleeding and infection. These risks are typically low, but they are still present. Some people also argue that circumcision can interfere with the natural functions of the foreskin, such as protecting the head of the penis and keeping it moisturized. The foreskin is also rich in nerve endings, which some people believe can enhance sexual pleasure. There are also claims that circumcision can cause sexual dysfunction or discomfort, but there is limited scientific evidence to support these claims. Another concern about circumcision is that it's a permanent procedure that can't be undone. While it's a relatively simple and quick procedure, it's still a surgery that requires anesthesia and carries some risks. It's also worth noting that circumcision is not without cost, both financial and potentially emotional. Some people may have strong feelings about circumcision, whether positive or negative, and it's important to consider these feelings when making a decision. Ultimately, the decision to circumcise a child is a personal one that should be made by the child's parents in consultation with a healthcare professional. It's important to weigh the pros and cons and consider all of the available information before making a decision. It's also important to understand that circumcision is a permanent procedure and can't be undone. In conclusion, circumcision is a procedure with both potential benefits and risks. It's important to thoroughly educate yourself on the subject and make an informed decision that's best for your child. It's also important to remember that the best way to protect against infections and other health problems is to practice safe sex and good hygiene, regardless of circumcision status. Thank you for watching. If you found this video informative, be sure to give it a thumbs up and leave a comment. And don't forget to hit that subscribe button to stay up to date with all of our baby-related tips and tricks.